Hi everyone, my name is Maddie. I'm going to talk to you about ending tobacco use on UW Bethel's campus. Let's get into it. So, what happens when you inhale cigarette smoke? So, what first begins to happen is when you inhale cigarette smoke, tar gets deposited into the lining of the lungs. So, within the lining of the lungs, there's little hairs that are responsible for getting rid of germs. And once those hairs are covered with tar, it hinders the ability to get rid of those germs. And once the lungs cannot clean themselves, infections start to arise, which is where you get high chances of emphysema and COPD. And smokers are actually more inclined to get the flu than non-smokers. Yeah. I'd like to go in on why I'm interested in this topic. So my father has actually had 2 heart attacks, and he was a heavy smoker. And ever since then, I've just been very passionate about like tobacco use, and I I'll probably never, ever, 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 ever pick up a cigarette in my life. So yeah, I'm a little bit passionate about this, which is good. So, my overall goal of this project would be to reduce and educate smokers on UW's campus to hopefully decrease the amount of smokers on campus. If I could just educate them, I'd be completely fine with that. Smoking is your choice. However, some people don't agree with it. I personally don't, but it's still your right to do it. And as long as you're educated and know your health risks. All right, so some potential stakeholders. Within this, I think the UW Health Club would be interesting because they're all about promoting health, and smokers their they have low health. It's a pretty big health disparity within the smoking community. The UW Medical Club, I decided to pick them because they're really interested in learning about things about medicine, and whenever they can get exposed to it. So, getting them exposed to preventative care like this would be really interesting for them, because if they want to go medicine, some of them might want to go general medicine or family medicine, which preventative care is a really big part of that. UW School of Nursing and Health Studies. So I think they'd be interested because health studies, public health, this is a public health intervention, so they might be very interested in going and creating an intervention and helping me with mine. The School of Nursing, because nurses seem to be very strict when telling patients not to smoke, but there are a lot of nurses that do smoke, and I feel like them being a part of this would also help them get around their own smoking habits. Evergreen Medical Center, they're a big local hospital, and I feel like they could really help me with funding, and they're too passionate about making our community healthier. And just local clinics, because I'm sure they get cases of smokers coming in that are having more serious problems, and I'm sure they'd like to fix that. So assess. 1/3 of college students use tobacco product, which is, I think, 1 out of 3 of us. I mean, if there's 30 kids in a classroom, that means 10 of them smoke, and I mean that's just a huge health disparity. That means that like those 10 students out of those 30 have are 13 times more likely to die of COPD than the other 20 students. So, and I think a lot of people think, oh, lung cancer, my chances of lung cancer go up. Well, not really. Your chances of any cancer go up just from smoking. Yeah. And so smoking also leads to decreased health overall in your body, not just your lung health. It affects a lot of things. So smoking interventions are effective when smokers have high support systems. So I was reading an article, and it was saying that they did it with college students in I can't remember the country, but they said that the lower socioeconomic status had higher relapse rates, which I found really, really interesting. So I think for my intervention, I'd want to set up like a hotline that they could call to where if they were starting to slack on it, they could come and get help. So my plan for my intervention, I would like to focus on a more fact and evidence-based intervention for smokers. So when we were in class and we did the Truth campaign versus the other campaign, we were all pretty shocked that the Truth campaign actually had a higher success rate. And I think that's because people don't really see it visually in their head. And once they see like how many deaths visually happen due to smoking, they're like, whoa. They take a step back and they're like, that's a lot. And so they really need to see what the outcome is. They can't, like, it's just too much for them to comprehend without being able to see it. All right, so what I would like to do for my fact and evidence-based learning is I would like to have an apparatus that has a hole where a cigarette attaches like a mouth, and there's an enclosed area with an air filter, and it will basically trap the tar. Also, I would like there to be posters that have, like, not gory, but true facts about what happens to your body when you smoke, and maybe some pictures to help kind of scare them a little bit. And also, I'd like my support groups for these individuals to take advantage of, going back to the article about how smoking interventions are effective whenever people have high support systems. So this is the apparatus. You see, like, the cigarettes coming out of the hole, that's the mouth. Then the plastic jar with the cotton balls would be your lungs. Yeah. So implement. So I would like everything to run smoothly, and I think I would have to have the following. I would need my flyers to be really effective. I would need the personnel working on the intervention to be well informed on the harmful effects. Therefore, they can communicate with the people and really try to get them not to be smoking. I would also want my demonstration to be shown to as many students as possible, because smokers, even non-smokers, can transform into smokers after one tragic life event. So I'd like everyone to see it, and maybe we could prevent non-smokers from becoming smokers. So how effective could this be? I'd like to have a poll where, I guess this is more my tracking element. I would like to have a poll where people, I could send out a survey if they'd like to be a part of it, where I ask them how their habits have changed, have they quit at all, have they increased tobacco use, and if they have just changed forms of tobacco use. I'd also like to maybe ask how many people went to vape pens, maybe, because I feel like that's a strong correlation with quitting, and I feel like people have higher quitting rates now that vape pens are really big in the industry. So what could go wrong here? Some people are just not as worried about their health as others, and I feel like this is really sad, but it's true. Some limitations include addiction, fear of being told what to do, kind of like how we talked with how banning cigarettes, people would freak out because they don't like the government telling them what to do. And everyone's body works different, so I just feel like there's going to be some people that are maybe quitting cold turkey might be really beneficial for them, and some people it could really, really hurt them, because a lot of people have withdrawal symptoms from nicotine, and that could be very detrimental to their bodies. So, I would expect to see a significant decrease in the amount of smokers on campus from this, just because of the research we did in class with the Truth campaign, but not always correct. Yeah, and I think that things could be adjusted along the way to make them more effective, like maybe changing flyers, changing the demonstration, maybe taking the demonstration away completely. Yeah. So my references, thank you for listening. Yeah, hope everyone had a great quarter. Thank you.